So today's up close and personal topics are going to touch on estrogen, menopause, natural aids in regards to menopause, and the Ebola virus. And of course, a little bit of like this or that. So first off, I wanted to start with hair loss. So in a previous video, it does look like I have hair loss here, but what happens is when I do shower and wash my hair daily, I tend to just towel dry my hair. I don't comb it or brush it in wet clumps. I put it up in a clip, and then I do apply my skincare and makeup for the day. And then once I'm done with all my skincare and makeup, that's when I brush or comb out my wet hair and style it. So what happens is because it's wet and I towel dry it and I don't brush or comb it, when I do put it up in a clip, it ends up in like large wet clumps, which makes it look like I have hair loss. But this is my hair brushed wet, or combed or brushed wet, and as you can see, so it's all good, baby. I'm going to do a get ready with me while I talk about those topics. So I'm going to start off with these eye drops, Rodo, and these eye drops, Rodo, and these have a cooling sensation. So in regards to the topic of estrogen, during my most recent pap smear and breast exam, my doctor asked me if I wanted her to prescribe estrogen replacement or hormone replacement therapy prescription, and I opted not to go through with it. And my decision was mainly based on women in my family, mainly my maternal grandmother, my mom, and my mom's old. So my maternal grandmother, she lived to the age of 92 years old, and she didn't go through hormone replacement therapy or estrogen replacement. Women of that generation, I give them much respect. They had to deal with their menopausal symptoms naturally. They didn't have the options of hormone replacement therapy available to them, and much respect to the women of that generation. So in regards to my grandmother and her being healthy, other than the dementia towards the later years of her life, her living to the age of 92, that really influenced. So that really influenced, that was one of the factors that influenced my decision to not go through with hormone replacement therapy or estrogen replacement. So my mom was born in 1948, and my mom was diagnosed with stage 3 GI cancer, which is gastrointestinal cancer, back in 2013, back in 2013. And she was treated at UC San Diego, and she had the greatest care there. I really rate that hospital like excellent. It is a comprehensive, fully comprehensive hospital in regards to cancer. My mom received her cancer treatment and went through recovery through UCSD. And her doctor offered her clinical trial options, and she did take that opportunity for those clinical trial options. And I think it was in regards to shingles, the shingles vaccine with cancer patients. And she took advantage of those clinical trials. UCSD advantage of those clinical trials. But UCSD definitely 100% such an excellent hospital. So in regards to my mom, she never took estrogen replacement. She never took estrogen replacement. She didn't go through hormone replacement therapy. My mom, she is such a strong woman. I admire her so much. She also had like a bovine valve replacement, and that's because she had rheumatic fever when she was a child, and because of that rheumatic fever that she had or contracted when she was a child, it affected her heart, and later on in life she did have to get a valve replacement, and she ended up getting a bovine valve replacement. But my siblings and I, and my children and her grandchildren, we played a huge role in her being caregivers for her, and played helped her out tremendously. We were there for her 100% throughout her treatment and her recovery. My mom didn't have estrogen replacement or hormone replacement therapy during her menopause era, and she's fine. Her heart conditions were a result of that rheumatic fever that she had when she was a child. And going back to stage 3 GI cancer is supposedly a very aggressive cancer, and just so grateful to UCSD and her oncologist, Dr. Eric Rowland, for helping her with her treatment and her recovery. And in regards to my mom's older sister, she opted to go on estrogen replacement, and she says that the estrogen played a factor in her. My mom's older sister, she was diagnosed with either stage 1 or stage 2 breast cancer, and she was on estrogen. She was on estrogen replacement hormone. She had a double mastectomy, and she did say that estrogen was a factor, did play a role in her breast cancer. So that's how these 3 women in my lives influenced my decision in not wanting to go through with hormone replacement therapy or estrogen. Some of the natural aids that I take in regards to menopause are eating a lot of tofu. I eat a lot of tofu. Soybeans are supposedly good for menopause. And I eat a lot of miso. I drink a lot of miso soup. And I do take calcium supplements supposedly for my, osteosporosis. But those are some of the ways that natural aids that I've incorporated into my daily life in regards to menopause. I'm sorry, I got so distracted. So I am going to use these 3 items. Remember these 3 Marie Claire makeup products that I got from Ross. So on to the subject of Ebola. So back in 2014 or 2013, I think, there was an Ebola outbreak in Africa, and two American doctors got infected with the virus. And what happened was UCSD, at that time, they had a drug called ZMapp that was supposedly cured Ebola.